we know that vaccination is key to our freedom, and high vaccination rates here in New South Wales have not just led the nation, but led the world. And behind the scenes, so much goes on, and it's a great opportunity for me as Premier today to witness that firsthand. And whether it's the Aboriginal Cultural Support Team that goes out and supports the Aboriginal community here in Redfern to help them get vaccinated, also to provide support during isolation. It's this work that the public don't really get to experience every day and see firsthand that really ensures that we keep people safe. And it's been very pleasing today as Treasurer to see that. Vaccination is incredibly important. We know that it keeps people safe, particularly those in vulnerable communities, those sleeping rough, and to be in a position that as we come very close now to a 90% first dose vaccination rate, that is incredibly impressive. And behind the scenes, our teams in health and justice are working tirelessly to provide that support, to provide that trust to communities, so that those who are most vulnerable get the support they need and vaccination as well. And we know that it's more difficult in different communities, and there are other communities that have very vulnerable people and need that support and that vaccination. And it's great to be here today with the Minister, the Health Minister and Dr. Chan to see that work up and close firsthand here today. I'm going to have Minister Henskins make a few comments in relation to his portfolio space and the great work that Communities and Justice are doing in keeping people safe. And then Dr. Chant will say some words as well in relation to the importance of vaccination. And I want to make this point very clear today, that as we open up on Monday, we need to open up in a safe way. But this journey is not over. There is a long way to go, and we need to continue that focus. The huge effort that everyone has made around our state to get out and get vaccinated, that effort has ensured that we can open up on Monday in a very safe way. And I appreciate and today I want to say thank you to everyone across our state who has made enormous sacrifices during this period of time, but importantly, made the effort to go out and get vaccinated. And behind the Minister's great teams here in Department of Community and Justice, in Health, who are ensuring that our most vulnerable in the community are getting the opportunity and the support they need to get through this difficult time.
Thank you, Premier. Thank you, Health Minister and Dr. Chant. And good morning, everybody. Here in Redfern, we have large social housing communities where many people have come forward to get the jab, not only to protect themselves, but also to protect our loved ones and their loved ones. And it's incredibly important for people to come forward and get vaccinated. We've had a full court press of community leaders, local grassroots organisations and the government working together, and we've seen a substantial increase in the vaccination rates in the last few weeks amongst our social housing tenants. I really want to thank the Health Minister, Dr. Chant's team and the team in the Department of Communities and Justice who have been working together so cooperatively and so effectively in terms of getting vaccination rates in our social housing communities to a high level. The government can only do so much. It really requires individuals to come forward and take the opportunities that we have given them, and the accessibility of vaccination hubs like we've seen today is obviously incredibly important. I'd really like to acknowledge our Indigenous leaders. The local Indigenous leaders have been incredibly good at encouraging vaccination levels in this community and throughout our state. We know how important it is to get vulnerable people vaccinated, and in the coming weeks we want to see the vaccination levels in our social housing communities and our vulnerable communities increase as we open up the economy and release our restrictions. Thank you.
Good morning. New South Wales recorded 580 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. I'll just do that again, given the bus. New South Wales recorded 580 locally acquired cases of COVID in 24 hours to 8 p.m. last night, and there were 79,894 COVID tests were reported during that period. We currently have 163 people in intensive care and 812 admitted to hospital. I just want to update the community in relation to the Delta strain that we reported yesterday in the update. So New South Wales Health is still continuing to investigate the source of the Delta strain. So this is a new Delta strain that's been identified through the genome sequencing. So as a routine, we do progressively do special testing on all of the isolates and we've detected a genome of the Delta strain which is different from that was previously transmitting in our community. We've linked that back to a person who returned overseas, but the exact mechanism of how that new Delta strain emerged and got into the community in Western Sydney is still under investigation. So we will update you as those investigations continue, but I just want to reassure you that there's nothing about this new Delta strain from looking at the genomics that suggests that it's any more transmissible, any more going to cause illness or any other issues additional to the current Delta strain. So in essence, it is another Delta strain circulating in the community. And we'll update you accordingly. I just want to mention about the booster doses. So just to reinforce that ATAGI, the Australian Technical Advisory Committee on Immunisation, yesterday recommended a third dose of COVID vaccine for people aged 12 and older who are severely immunocompromised. And this is due to emerging evidence that some immunocompromised individuals have not as good immune response and need that third dose to get that best chance of protection. So for the third dose, an mRNA vaccine, Moderna or Pfizer, is the preferred to AstraZeneca, and the recommended interval between that third dose is 2 and 6 months after the second. So I would urge everyone, this is updated advice, if you've got, for instance, renal dialysis, you've had a transplant, you're undergoing chemotherapy and immunocompromised, now is the time to discuss with your doctor, and if you've had your vaccine, particularly within 2 to 6 months, please reach out to your doctor and check whether you now need the booster. I should say that ATAGI is currently looking at the issue of recommendations around further booster doses, and we are expecting the guidance in relation to other areas for such things as healthcare workers, the elderly and other categories to be coming in the next couple of weeks. In terms of areas of concern, we're still seeing declines in a number of areas in southwestern Sydney and western Sydney, but I just still urge those communities to come forward for testing. There are still high rates in a number of the suburbs, and we do want to continue to see those case numbers decline. In terms of far west, Broken Hill and Wilcannia, the case numbers are pleasingly settling, but we have seen a number of cases related to Dareton. And I want to thank the community for a great testing response in Dareton, but please continue to get tested, get vaccinated and follow the public health advice. In relation to our Hunter and New England area, we've obviously been mentioning that we've been seeing increasing cases over recent weeks in that area. Taree and Tamworth are of increasing concern, so please be very vigilant, continue to come forward for testing and importantly get vaccinated. And Cessnock and Lake Macquarie area, we're continuing to see case numbers reasonably high. There have also been new cases in Walgett and new cases in Cowra, so again a call out for the regional communities to be particularly vigilant and most importantly to come forward and get vaccinated. The access to the vaccine has increased markedly over the last couple of weeks, and so it is important that if you have a delayed vaccination appointment, please try and reschedule that earlier or look for other options. We do really want to see us get to as high as immunisation coverage as we possibly can, as quickly as we can. Thank you.
Yeah. Can I just say again what a privilege it is to be here yet again in Redfern. Redfern is, of course, to me, it's the crossroads of Australia. We have obviously a very large Aboriginal community, but also many people from all across the world who've made Australia their home here. And to meet and talk to them and hear what they have to say today has been a privilege. But can I also say thank you to the health team, the housing team, the community organisations that have come here to work together to make sure that the community here are vaccinated and kept as safe as all of us can be in Australia. We are a very lucky nation. We have had the vaccines available. We have now a plentiful supply of vaccines, and there really is no reason other than a medical reason to not get vaccinated. I want to thank the community of Redfern for coming out and getting vaccinated, and for those who might have been a little reluctant to come in, I want to thank them for coming and talking to the various non-government organisations, the health team, the housing teams, the government agencies that are down here working with them, and to actually place their trust with us and to have been vaccinated. It strikes me that we're now up to 70% double dosed across New South Wales. We're leading the nation. Can I just say to those who haven't yet got vaccinated, please go and get vaccinated. It's not really reasonable or fair that 70%, or even when we get to 80%, it's not fair that 70 or 80% of the community have done what they can to keep the rest of us safe. I would just say that our obligation is for all of the New South Wales residents to keep our entire New South Wales community safe. Go and get vaccinated. There's plenty of vaccines available, as Dr. Chant has just said. There's obviously Pfizer now. There's Moderna in a lot of pharmacies very close to you. It's not far away. Usually it's a short walk from your house to where you can get a vaccine. Go and keep yourself safe, the community safe, and of course New South Wales safe. Thank you very much.
Raz just reminded me I'm Premier. I think I said I was Treasurer, so don't worry, Matt Keane, you still got the job.
Premier, are you still getting used to the title then?
When I hear Premier, I think of Glad. That's just part of obviously the change. But I've been Treasurer for 5 years, so it takes some getting used to.
Premier, under your roadmap plan,
Yeah.
what is the maximum you're expecting for daily cases and the daily death rate?
We know that as we open up, case numbers will increase. But what has been key to keeping people safe is our high vaccination rate. We have the highest vaccination rate in the country, and importantly, we're coming close on that first dose mark to 90%. On our roadmap, it's more conservative than the federal roadmap that was set out by the Australian government. We believe that our conservative approach here ensures that we keep people safe, but importantly, gets people back into work as quickly as possible. This crisis has many facets, from the health side of things to the economy, to mental health. All these areas are incredibly important. We want to make sure that we open up well on Monday. And I want to make the point today, and I'll be making it again tomorrow. It's going to be a difficult time as we do open up, but I ask everybody to treat everyone across our state with care and kindness as we open up. We are the first state to going through a process where things will open up for those people who have been double vaccinated. That's important. From all the discussions we've had with health, but for that approach, we wouldn't be able to open up on Monday. And once again, I thank everybody across our state for the efforts they've made in getting out there, getting vaccinated, keeping everyone safe, and that ensures we can get people into jobs and businesses back open.
Premier, but on that note, highest cases to date has been around the 1,600 level, 15 deaths in a single reporting period. Under the revised roadmap, do you expect either of those fronts to increase? Naturally,
we will see, as New South Wales opens up, case numbers increase and hospitalisations increase. That is a natural part of opening up, and that's why we've done this in a safe way and ensured that we haven't done so until we've had that vaccination rate where we wanted it to be. We hit the 70% mark. We set those milestones out. Our case numbers are lower than we anticipated. That's an incredibly positive thing for the people of our state. That means people have been following the difficult rules that have been in place. There have been challenges, but there's no doubt as we open up, cases will increase. We will learn to live alongside the virus, but importantly, in doing that, what we have to do is get that vaccination rate continuing to increase. And as the Minister has said very, very clearly, if you haven't been vaccinated yet, please go out and do it. That keeps you safe, your family safe, and your friends right across New South Wales.
On Monday, people will be able to travel, see their loved ones for the first time in months. there's no doubt that a lot of people aren't going to want to wait this weekend, this beautiful sunny weekend, to do so. Are you going to be ramping up police presence, making sure that people trying to bend the rules around travel are fined, or will they be released?
We trust the people of our state. Everyone across New South Wales has made enormous sacrifices during this period. People haven't been able to farewell their loved ones who have passed away. Grandparents haven't been able to visit their grandchildren. We know the sacrifices that people across New South Wales have made, and I thank you very much for that. We are very close. Monday we open up. Everybody has been patient. Businesses have had to remain closed, but I know there's a sense of excitement, and it's great that we're opening up at a very difficult period of time for our state. But importantly, we want to keep people safe, and I just ask people over the next day, over the course of the weekend, please follow the rules that are in place. We want to open up safely. We've done so in a conservative way that ensures that as businesses open, people are safe. Healthcare is our number one concern. At the same time, we want to get people back into work and businesses open. And the other point I want to make, and I'll reiterate this tomorrow, there'll be many young people, 18, 19, who will be in retail roles on Monday. It'll be a challenge for them. So please, when you do attend a restaurant, a cafe, a pub, please treat them with respect, because it's going to be a bit of a challenge. I know it's not going to be perfect. I'm not going to shy away from that, but ultimately, if we all work together, we'll ensure we come through this period of time stronger.
Premier, with schools opening now a week earlier, and also with some information coming out of the Department of Education that within 5 years there will be a shortage of teachers. There's about 5,000 teachers who have signed a petition that they don't want to get vaccinated. I know personally a number of schools are grappling with staffing. What's the solution? We need teachers. We know that historically we don't have enough of them, and there are several thousand that won't be vaccinated.
Well, the first point I'd make is we want all our teachers to be vaccinated, and in the main that's exactly what's occurred. I want to thank the Education Minister who's worked very closely on the roadmap. We need kids to get back in the classroom, but we need to do it safely, and we've made the rule that those teachers who are in face-to-face learning need to be vaccinated. That's incredibly important, and we'll continue to allocate resources over time. We obviously want more teachers and the best teachers. There's nothing more important than the education of our young kids.
So how do we meet the shortage in the short term?
Well, we'll work through that. But the advice I've received from the Education Minister is that by bringing that date forward, that they're able to ensure that face-to-face learning can occur. They're working tirelessly over this period of time and have been. They've done an amazing... Every area of government has worked closely together. Today, witnessing firsthand justice, working with health. Education has been working with health to keep classrooms safe so that we can return kids to school as safely as possible and as quickly as possible. That's incredibly positive. Sure, I saw the reports in relation to teacher shortages down the track, and obviously we'll address that as a government, but I'm very confident based on the advice that we've received from I've received from the Education Minister that we were able to get kids back in the classroom on that date of 25th of October, and I've said in the past, and I'll say it again, it's great for kids and it's great for parents.
Premier, there's been concerns raised by doctors about bringing forward pregnancies a little earlier, according to a new roadmap, and the federal AMA effectively accusing you of sidelining up those advice. What do you say to that?
Well, that's untrue. I mean, during this period of time, there's always been different advice that's given. There's always different opinions. I saw an opinion the other day on the 7:30 report that said the exact opposite from a leading doctor who said the changes that we've made in bringing forward the roadmap are modest and ultimately will ensure that we keep people safe as we open up. This is a balance, and that's the approach the New South Wales government, the successful approach that we've taken over the course of the last 18 months. We listen to the health advice, we listen to the economic advice, we listen to the mental health advice as well. There are many challenges that occurred during a pandemic, and it's not just New South Wales. I think Australia has done incredibly well. Our hospitalisation rates and death rates are some of the lowest in the world. Our economy last year, in the June budget this year, which seems like an eternity ago, our economy was stronger then than it was at the start of the pandemic. All the jobs we lost last year, close to 300,000 jobs, we recovered plus 30,000 more. Every person across our state has made enormous sacrifices, but our commitment to our people is to keep people safe, to get people back into work as quickly as possible, and to get businesses open. We don't want businesses to close. We know the mental anguish that causes. We want to provide opportunity and prosperity for the people of the state. Everything we do is in a measured way, in a considered way, based on the health and economic advice. We don't always get it right. We've made mistakes. Last year, every government around the world has made mistakes. When you make mistakes, you put your hand up and you move on. That's an important part of being a leader in a pandemic. We've got a great team of ministers, a great team of public servants who provide their support and advice, but ultimately it's ministers, elected officials, who are responsible for the decisions of the government. Our role is to listen to advice and to make decisions off the back of it. And yes, there'll be challenging times ahead. We make no qualms about that. We are still in a pandemic. Case numbers will increase. Hospitalisations will increase as well, but our vaccination rate has been key to keeping people safe and importantly being able to get people back to work as quickly as possible. And I'm excited about the opportunity that people will have for the first time in a long time to open their doors again, to get back to providing for their families. And the way we've been able to do that has not been because of the government, it's been because of every single person across our state who's gone out and got vaccinated.
We are tracking to hit 80% on the 18th of October. Does that mean that 80% freedom will kick in on the 18th, which is a Monday, or will it be the 25th as set out by the previous millennium?
Well, the first point is that we have said that the date for the second phase of our roadmap will kick in at 80%. So firstly, we're not there yet. So it's really, really important that people go out and get vaccinated to ensure we get to that date. I don't want to preempt that date. We were asked questions about whether we bring the date forward on the 70% to Friday. We made the decision to maintain that on Monday. The Monday after we hit that mark, that is the government's position, because also we need businesses to adjust. And I haven't made this point yet, but there's going to be some difficulties in relation to that. There's a lot of information on the Service New South Wales website so that the businesses right across the state have the information they need for signs, for training staff. That's all very, very important. And please treat, as we do open up at 70%, we'll have more openings at 80%, that you work closely with businesses because they'll be going through a challenging time too, having to adjust to new settings. But if we all work together as a state, we'll operate in a very good way.
Is it likely that more changes will be made to the roadmap as we approach that?
I'm not going to preempt that. We're very comfortable with the changes that we made 2 days ago to the roadmap. We believe that they're modest changes that ensure there's greater flexibility and freedom for businesses. As we open up, we want to set that roadmap in a way that provides stability and confidence. Confidence is key. Consumer confidence, business confidence, that's what kept our economy moving through last year, and that's going to get us moving through this year. So as much certainty as we can provide businesses in an uncertain environment, we will. And one of the key ways we can do that is providing clear advice on what the restrictions are at a point in time. We've set that roadmap out. It's very clear.
Premier, it seems that the gyms were under the impression that from Monday they could hold outdoor lessons for unvaccinated people. But taking bookings along those lines, but now things that advice has changed, it's disappeared from the health website. Can you confirm what the situation is?
I'm not sure that's the case. My understanding. Oh, here we go.
Yes.
Health Minister. Yeah.
I think there was a bit of confusion about that with some of the stuff that went up on Service New South Wales, but basically the rule is that unvaccinated people can currently only meet anyway in groups of 2. So again, the reason why to go and get vaccinated. And that would apply to the gyms as well. If they've got a couple of people outside that are doing, effectively having a get-together but doing some exercise, that would probably be okay. But I think they thought they could have a whole gym out there. The answer, no. No.
Right.
Get vaccinated.
Very clear. Oh, great.
Yeah, sorry. Not a lot. I saw that in the paper this morning. I haven't been told by the federal government, but I welcome it. We've had a real struggle actually because with some of the visa requirements that have been in place, we've wanted to bring people in, nurses, doctors, during the COVID pandemic, but it's been a struggle. So what I would say is I welcome the announcement by the federal minister. Our health system can certainly use some additional staff, but I've got to look at the detail when he contacts us and let us know the detail. Sorry. Dr. Chan, yes? Oh, sorry. Miss? Can you, at a big voice? It's a bit noisy here. Big voice.
Given the low vaccination rates in some areas of regional New South Wales,
Yeah.
will you delay opening up those regions to go to Sydney? And also, given that some areas have gone back into lockdown recently, will they open up with the rest of the state?
Look, we've made it very clear there's a path out of this, and it's when we get to 80-80, the regions will obviously open up. What I would say, though, is don't assume that we won't go into some form of restriction or lockdown in some areas where we have particular case numbers coming up quickly. We still have to look at all that. I think Dr. Chant and the team will give us some advice on that as we go forward. But again, the message to the community is go and get vaccinated. There's plenty of vaccine. Go and get vaccinated. We all want to get out. We want to get rid of this artificial boundary, if you like, between the Greater Sydney area and the rest of our state. That's something that is actually within our hands. As residents here in New South Wales, it's within our hands. All we've got to do is go and get vaccinated. We want to be a million miles in front of states like WA and Queensland. The way to do it is get vaccinated. Dr. Chant, next. Yeah.
Just a few quick questions about the new Delta strain. So can you clarify, how long did it take between this first case presenting to New South Wales Health and you identifying it as a new strain? And secondly, which country have you investigated that this new strain came from?
Okay, so as you can imagine that our genome sequencing is done, we've got a lot of cases, and so it does take some while to go through. So what's happened is they've recently, this dates back to September when this returned traveller came in. Now what we're investigating is, was there someone else on the plane that was positive? How could it have got out? What was the mechanism of that? And obviously we haven't genome sequenced every one of our isolates from all our people, and so really we're still finding out how much transmission has been generated in the community from these cases. That will evolve over time. I think the main thing for the community to understand is that there's nothing different about this. It's a different Delta strain, but it's still a Delta strain. So we know its characteristics are the same, that it's likely to be much more transmissible than previous strains. It's associated with more hospitalisations for those older age groups, but it's not got anything that makes us more concerned about this strain versus the others. So we will work through those investigations in the ordinary course, but it really doesn't change our public health response. Everyone needs to get tested, everyone needs to isolate while they wait for that test. We need to follow the rules and be COVID safe. I think as we're pushing our vaccination coverage as high as we possibly can, what we're hoping to see is a decoupling of case numbers from hospitalisations and deaths. So that's what we've observed overseas, that you can have higher rates of cases, but a decoupling. And we also know we have plentiful vaccines. So when booster doses become available, we've done a great job at vaccinating. We'll be able to roll out those, meet any recommendations that a Otago might make in relation to booster doses. So my key message would be continue to get vaccinated. It's going to protect you, your loved ones, and the broader community. And thank you to those 12 to 15-year-olds, or should I say their parents. They're just going very, it's amazing to see them go up by 2 or 3% a day in terms of vaccine coverage.
Do you know how many people died?
Oh, apologies. We're reporting the deaths of 11 people, and I'll read out the details. And again, this highlights the fact that we've got to take this COVID seriously. Tragically, the deaths of 11 individuals, and in our release, apologies, I'm just looking. Apologies for that. So it's 3 women and 8 men, and we can provide further details about their vaccination status and their underlying comorbidities for the community. But obviously any death is a tragedy, and that's why it's so critical. I would like to say that we will still have deaths in vaccinated individuals and unvaccinated individuals going forward, but we know the vaccines are so effective. It really behoves each and every one of us to do it for ourselves our loved ones, but the broader community. So my key message is please get vaccinated.
Are you still comfortable with the revised changes to the roadmap? Are you comfortable with those changes?
So the revised roadmap changes were formulated in the usual way, where public health advice is put on the table. There are decisions made. Everyone is aware, there's both also an individual responsibility. There's a great mitigant in all the plans that we're actually preventing people that are not vaccinated going into a number of the higher risk settings. But individuals need to make their own decision also as we work through this. I've given advice before that it takes 2 to 3 weeks after your second dose for immunity to kick in. So please, whilst that isn't a feature of the way we've the roadmap, I would ask that people are a little bit cautious in going out and about until they've had that period of time. Clearly, if you're immunocompromised, I've indicated today that ATAGI has indicated you need a third dose to give you that optimum protection. So everyone, as we move to live with COVID, has to also adhere to the personal responsibility around vaccination and also physical distancing, not going out and about when you've got symptoms of COVID. This is very much a shared responsibility as we continue to live with COVID into the future.
Do you feel your expertise will get more the sidelines?
No, not at all. I would just like to say that I had the opportunity to brief the Premier. I think the briefing went for well over an hour, almost 2. Presented to Crisis Cabinet in the usual way. And as I, respect government's decisions around multiple inputs. But I also note that some of the changes are very clearly very low risk. I mean, we have to accept that we sometimes use public health orders as a one-size-fits-all, and so things like there will be different capacities across different venues, for instance, where we know that some venues can take a much larger group of people because of the way that people either travel there in cars. So I think that there's some really practical elements that we will work through. And I do want to say that we do need to, as we live with this, there is that component of personal, business and government frameworks. And I will always continue to give my public health advice, and I'm very appreciative of the fact that government has incredibly, given that a good airing.
Doctor, are you nervous about the coming weeks as a doctor, as our top doctor in the state? How are you feeling?
I sort of have trust in the people of New South Wales. I have trust with the framework. I have trust that we will continue to embrace immunisation. I would like to see the things that would give me greater confidence and greater joy will be when I see that first dose continue to go up. We know that from now to get that above, we're likely to get to 90% either tomorrow or the next day in terms of first dose. But we know that every increment above that is just going to be a bit harder. ACT's got up around 94%, so my challenge not that we want competition across states, but can I just say that I would be really happy for us to get there, and I actually think we can. So can I ask the community to really reach out? I know the local work that's being done here to look at the barriers to immunisation, but that might be amplified on a small scale in all of your communities. So reach out to your friends and family and see what you can do to support them to get vaccinated. We need to make sure that no one is left behind and everyone's had that opportunity to take these vaccines, which are highly effective.
Thanks, Premier, just a quick question on international travel.
Yeah.
It's set to kick off in November. Where are we at in terms of planning on how travellers would quarantine, and will home quarantine be ready to go in New South Wales?
Well, we're working through that right now, and Minister Ayres has responsibility. I spoke to the Prime Minister twice this week in relation to international travel and areas of joint responsibility. We're likely going to be in a situation where people in New South Wales will be able to travel to Bali before they travel to Broome, and that's just the reality. But New South Wales is going to lead the nation out of this pandemic. We want to open those borders in a safe way. There's a trial occurring now in relation to home quarantine, where we will look at that, work through that with health. But obviously, as time moves on, as vaccination rates increase, the need for hotel quarantine will be substantially reduced. We're working towards the opening of international borders in November, and I'll continue those discussions with the federal government, and Stuart Ayres is currently working on that pilot. It was a matter that was before the crisis cabinet last week, in terms of the work that he is doing, and he's bringing something back to our new committee over the next week or so, and we'll have something more to say about that shortly. But ultimately, we will be moving away from hotel quarantine to home quarantine over time, because that's what makes more sense.
Thanks, everyone.
Well, one last one. Yeah.
A non-COVID question, Harriet. During today's State Labor Conference, the opposition leader is expected to foreshadow a bipartisan approach to ending secret donations to political parties. Are you supportive of that?
Of course there shouldn't be secret donations to political parties. It's refreshing that Labor has moved on from the days of the Audi bag into some donation reform. That's positive. But look, obviously I haven't seen the details, but if that's what their policy is, that sounds incredibly refreshing.
Thanks, everyone.
Thanks.
Thank you.